Hello, I am Dr. MANASWITA Biswas Agarwal. I am an anesthesiologist and a critical care specialist. I am here at the Live and Life event, which focuses on health and lifestyle. So, what is an anesthesiologist and a critical care specialist? A person who take care of your anesthesia when you are in a surgery and also the person who takes care of your illnesses when they are very, very critical. So, what is critical care? Critical care, when we hear the word, it gives us goosebumps. Critical care is very, very critical. It is a critical disease. Yes, it is a critical disease which is usually taken care of when in you are in a intensive care unit, that is a critical care unit. But nowadays there are diseases for which we don't need a long term stay in a critical care unit. Once the criticalest part, like the most critical part of the disease, is tackled, we can shift the patient outside the critical care unit so that another patient can get his birth who needs it uh, definitely inside the critical care unit. So, what to do with that patient who is not that much serious to be inside a hospital setup? We can pretty well keep that patient at home setup with all the critical care needs served at home. So, in that way, we gain a lot of things. First of all, the person who is in the critical care unit is our relative, our very near one. If we are able to see them regularly, getting them treated in front of our eyes, will be a bliss for the family. On the other hand, the patient who is in a critical illness will also be comforted a lot when he or she can see the family around. What is the most important part of a critical care for which we think 1,000 times before thinking of home based critical care? It is sterility. A patient in a critical care unit has a lot of lines and channels inside his body going through the veins, through the mouth, or maybe through other parts of the body. They are very prone to get infected. That's why maintaining a critical care in home setup is a challenge. But it will no more be a challenge when you have the proper equipments, you have the proper setup, and you have the proper people. And the most important person to guide you on all those things, including your treatment and medication, is a doctor, a critical care specialist. And that is what I do. So, along with the patients in the critical care unit in the hospitals, we can take care of patients in critical setup at home as well. This is very useful when we talk about old age diseases. When we talk about diseases in a children, in those cases, keeping the patient away from the family is a very, very heartbreaking thing. For example, I'll give you an example. A cancer patient who is in the end stage of his or her life. We all know, including the patient, that the patient is not going to survive. If the last days of those patients are at home, in a home setup where that patient can see and meet his family members day in and day out, then that will be the best thing. That might be the best medicine that will make the patient happy. And that is what is critical care at home. So, at the end stage of life, when our parents, grandparents are in an ailing stage and they are at home and there is the setup to look at them or take care of them completely, that is what is a gift for us. So, that is what is critical care at home. So, this is for the critical patient. Now, what is preventive health? Preventive health is very, very important nowadays. COVID has taught us how preventive health is important. In the midst of COVID, we have almost forgotten about all the other diseases we have. and we have stopped taking care of them. And maybe we are approaching to a time when a catastrophe can happen. When we were children, especially when I was a child, I used to hear to incidents like some of my friends' grandfather passed away suddenly in a heart attack at night. Heart attacks don't happen in a day or just suddenly. It's some diseases within which keeps the growing, and we don't take care of it. We don't give importance to the signals the body gave us, and we land up in a catastrophe. So that is all about preventive health. So we should prevent a catastrophe. We should be healthy, happy, and doing the right kinds of thing. And the person who can guide you the best in such a thing is your doctor. So it is not you should reach a doctor when you are ill. You should reach a doctor so that you are never ill. You are always healthy. So that is what we do. That is what I do. We are focusing on doing a good health, having a good health even when we are at home. We don't need to move to a hospital for that. We don't need to land up in a problem for that. What we need to be aware. We should be aware of our health, and that is what is all about preventive health. So, if you think you want to know more about critical care at home or preventive health, you should obviously get back to me and also tell me how did you find my video. Thank you.